Metatarsal stress fractures are multifactorial injuries that are very often seen in patients who do a lot of long distance running and unfortunately don't take care of themselves when they are doing so. The mechanism of injury can include a lot of different injuries. Generally speaking, a lot of them are due to anatomical issues within the lower extremity. These anatomical issues lead to biomechanical changes in gait, running, etc., which then lead to compensatory adaptations that the feet cannot handle very well. Some of those anatomical deviations or issues are things such as forefoot varus, having a dorsiflexed first ray. Unfortunately, both pes cavus and pes planus can cause problems. Pes cavus is when the foot has a high arch, therefore it's a poor shock absorber, and so it's very immovable. But conversely, pes planus can lead to a hypermobile arch as well, which leads to inefficiency with push-off. Individuals who have a leg length discrepancy or Morton's toe can also have these problems. Morton's toe because, again, this puts stress specifically on that second metatarsal. Other issues that can lead to these stress fractures includes training. As we talk about a lot, overuse in increases in distance, intensity, and frequency at a level that is higher than it should be can lead to these problems. If you have this overuse injury, you have really an accumulative microtrauma that takes place. And thinking back to how bone builds itself up and breaks itself down, when you have this accumulative microtrauma, osteoclasts tend to be more active than the osteoblasts, so you get a lot more breakdown. You're going to see this especially in runners who are putting in more than 20 miles per week. That really can cause an increased risk for this problem. Another problem or reason for these injuries has to do with gender. And you've probably heard of the female athlete triad, which is a trifecta of issues that includes bone loss, menstrual disturbances, and an energy deficit, usually due to a disordered eating. If you have disordered eating and that energy imbalance, you're not getting in the necessary amount of food and nutrients that's necessary to help build those bones. The menstrual disorder, amenorrhea, is defined when a person has lost their menstrual cycle, usually at least 1 to 3 menstrual cycles over a period of time. So amenorrhea is the loss of that menstrual cycle. This becomes a problem in that the menstrual cycle involves the hormone estrogen, and estrogen is very important in maintaining bone. Finally, bone loss, osteoporosis is going to be a problem, and it makes sense if we're looking at stress fractures. Risk factors that affect bone loss: 60 to 80% of the people that have osteoporosis are going to be female, so that gender contributes there. But other things can affect that bone loss: nutrition, exercise, body mass, hormones. Again, estrogen mediates bone genesis, so we can't get that bone building if estrogen is not there because the person is not eating well and or has lost their menstrual cycle. So it all becomes kind of a vicious circle in this situation. So signs and symptoms of this stress fracture include a localized inflammation to the metatarsal that seems to be involved, as well as pain and point tenderness at that involved metatarsal. Pretty common to any other place that you may see a stress fracture. Range of motion, you're going to find that the person tends to have pain with active range of motion during dorsiflexion of the foot. There are several special tests. These are your standard tests that you're going to use when you suspect fractures. This includes longitudinal compression test, the tap test, the squeeze test, and the seesaw test. Diagnosis can be done through x-rays. Unfortunately, with x-rays, the calcific deposits really do not show up until at least 2 to 3 weeks post onset of signs and symptoms. So by that time, that's great if you can pick it up, but that tells you that you're already 3 weeks out. When people come in first thing and they've got that pain, you're not going to be able to see that on the x-ray. And so the gold standard is a bone scan. Bone scans are going to be able to pick out these stress fractures within 48 to 72 hours post onset of signs and symptoms. And we will call these hot spots on the bone scan, and you can see that in that left picture how you've got the hot spot on the plantar surface of the right foot. Treatment, unfortunately, we treat this like a fracture, and so the person will be in a walking boot from anywhere from 6 to 8 weeks. If there are malalignments after the walking boot has been removed, oftentimes an orthotic device will be inserted.